What's up, everyone? Make sure you check out the West West Network website at westwestnet.com. Here you can find amazing independent podcasts based in Aotearoa, covering everything from pop culture to mental health. Also, if you enjoy our content and want to support us, please consider clicking on the support button on the homepage of the website. We appreciate your patronage and look forward to delivering more thought-provoking and quality conversations. I do think, and it's been shown over and over and over again, that when certain governmental institutions get certain powers, they refuse to relinquish it. You know, you look at all over the world, this has been the case. Fight me if you think I'm wrong. As a new form of working, so I don't know why we still can't get it working. Oh my god.
It is so funny, Gio, because I've been using Zoom only on my mobile, my work mobile, and I haven't actually tried to do it on the laptop until a few moments ago.
Oh my god, you're like missing out because it's just so small. Using your mobile is so small. And how do you do it when it's the group meetings?
Still mobile, which is
you were shitting me. You were shitting me.
You won't believe me, Gio, but before lockdown and everything came in, I only used my laptop or a computer for uni work and stuff. After that, everything I ever did was on my mobile. So to access my internet, my banking, everything on my mobile. And then, suddenly I had to work from home. So it was quite interesting having to get my laptop up and running and everything.
You're a simple man with simple needs.
Yeah, it is so funny, Gio. So I'll usually very comfortable and quickly do whatever I need to do on the mobile.
Exactly.
Because you can do your shopping and everything on it, like the banking and.
You know what you need? You need a tablet. That's what you need, which is slightly big, which is actually more than slightly, which is bigger than a mobile, but not as bulky as a laptop. And you can basically do the same thing. You need a tablet, bro.
Tablet.
You can't continue working in a level 3, level 4 lockdown scenario using your mobile only. Yes, mobiles are useful, but you need to step your game up a bit, bro.
For a moment now, I'm thinking, I've gone to the next level doing a Zoom on a laptop.
Are you telling me that you've never used Zoom on anything but your phone since we went into lockdown last year?
Yeah, I'm presenting cases, everything on it, man, which is
you
awesome.
Are shitting me. Well, mind you, I might be a bit spoiled, but I can't think of anything worse than having to use one screen. Even now, as we're talking, I'm using 2 screens. The other screen has Unichem Peninsula Pharmacy on it. I don't know why, but it's open to that pharmacy.
This is so cool. No, it's random because I put my phone on the side of the laptop so I can still see my work and everything. And I don't really need to see the people on the other side of the Zoom. I just need to talk in here.
Oh my god. Okay. I don't know. I mean, listen, I'm very impressed at the same time that you've been using a mobile this entire time. But at the same time, I'm also horrified that you've only been using a mobile this entire time. But I think I'm more on the impressed side.
I think I'm becoming a dinosaur when it comes to technology, Gio. It's actually scary because technology is kind of developing so quickly, and I'm kind of falling slightly behind. So it's good to kind of upskill a little bit.
You're not even that old. How can you be falling behind in the technological advancements of the world and you're not even that old? Come on, bro.
I know. Come on, bro. So random.
Okay. Well, let's far out. I mean, it's good that we're back on doing the podcast now. I mean, Jesus.
It's been a while.
If I had to look here, the last time we uploaded an episode, it would have been. Let me check here. Oh, no. I accidentally turned on something that I shouldn't have. A previous video. 1 month ago. Our latest episode 5 was 1 month ago.
Yeah.
So we are. It'll be over a month ago, but we have definitely not kept up to our goal of one episode a week. But excuses.
And that buff,
Um,
because the one episode a week was kind of to get a bit of a buffer, but then
that buffer
um,
went quick. That
very
buffer went
quickly, very quick.
quick. Oh my god. I thought we were so ahead when we had like 5 episodes and we hadn't even like released we had only released one and we had like four extra. I was like, this will last us a while. No, that went by quick and it all went. But I'm glad that we're back on some form of recording, some form of
Yeah,
conversation, because the only time I get to talk to you is either during a handover or you're handing something for me to do, or I'm handing something for you to do, which is
yeah, and
annoying.
it's not the same as not having your colleagues around and stuff, and you know, it's less impersonable, if I can say it that way. Like it's not as personable.
No, 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 you're definitely right. I mean, as much as we're still getting the information across, but this whole Zoom thing it's like you said, it's so impersonable, unpersonable.
I'm not
It,
even sure
oh,
there.
whatever, whatever. It's it's not the same as like face to face human
Yeah,
interactions. You
yeah.
know what I mean?
Yeah, and to be honest, it's actually exciting doing a podcast with you on Zoom. As you a few moments ago, I just upskilled, which is kind of cool. Doing my first Zoom on a laptop.
Oh, bro, it's the
And
small things.
and as you know, there's been a topic I've been really keen to talk to you about. And I think it definitely deserves an assessment.
Yep, you have been
And
telling me that for a while. You said as soon as we're back in the studio, back to recording, you've got something you want to bring to the table. So I'm excited
yeah,
to hear it. I'm excited to hear it. What do you got?
well, and to be honest, doing it via Zoom, our meeting actually kind of captures it very well. Is the
Mm,
whole COVID-19 kind of situation we're in, especially kind of having to adapt so quickly, working from home, and it's a massive topic.
mm.
And I guess just doing it's evident by our Zoom podcast at the moment. Can't even see one another to do a podcast. So you
Which
know,
is a shame because I actually did clean up the studio, and it looks. I have to admit, it looks really nice right now. But
mm,
we're gonna have to wait until I don't know. Can we do podcasting level two? I'm sure we can. I'm sure level two our bubbles will be a little bit more open, right?
yeah, because it makes it a bit harder for you and me because we have kind of two barriers, I guess, or two things to consider. One is the expectations from, I guess, government. Kind of who you can extend your bubble to, and and then at work as well, we're in separate teams. I'm in the blue, you're in the green, and we are not able to merge bubbles, so
That's right. We got two
which makes it
different
even
bubbles.
harder.
Yeah. We got two different bubbles we have to consider our household bubbles, but also our work bubbles because we are still split at work, which is another frustration. But anyways, I digress. So you mentioned you had a conversation you want to bring to the table, and I'm guessing it's around COVID-19
Mm.
and all the bullshit we've been going through.
Yeah, so I actually wanted to basically, it's a very open-ended question, but how are you finding, the situation we're in at the moment?
Well, I if you go to the West Network website, the westwestnet.com, you'll see I wrote a very short article there exactly outlining how I feel about working from home and COVID-19. It was a really brief opinion piece. I was doing work and then I got frustrated because of this, then the other, and I decided to just put my thoughts onto paper, and then it came out with this half-assed, poorly written um, article. But anyways, I I'm in two minds about it. I like working from home, even though I was very against it at the beginning. I think
Mm.
mostly because I've worked really hard over the years to not bring work home and home being purely for home.
Yeah.
But now that's kind of out the window because I am literally working from home. So I've brought not only a little bit of work, I've brought the entirety of work home.
Mhm.
But I also really enjoy it because I'm at home. I'm spending time with the kids. I don't feel like I have a lot. Not that we get that much oversight, like in terms of like being told what to do, but like I feel a lot more freedom at home. I mean, if I wanted to walk outside and go for a quick walk around the block, I can. I mean, we do that at work anyway, but
Mhm.
um, I can do work in my pajamas, which is a different kind of freedom. But I don't find it particularly that bad. I
Mhm.
think my initial impressions of it was that it was going to be terrible and it was going to be difficult, mostly because of the lack of resources and supports that I usually get at work from my colleagues and from the doctors and from everyone else. That's still missing quite significantly in the work that I'm doing at home. But overall, I'd give it an 8 out of 10. 8 out of 10 being good. You know.
Yeah.
What about yourself?
It's it's very similar, Giovanni. Like, I kind of enjoy change and I like adapting to change, especially if change is for the better. Can't necessarily say this is for the better. It's different, definitely working, from home. So your home in effect becomes your office, and as you said a few moments ago, especially working in mental health, it's always good to keep your private life and I guess working mental health, your professional life separate. Um, so now suddenly you're working from home, um, and I kind of find it kind of cool that I'm able to access everything I need, my work emails, the system we work on, um, everything basically, doing all my phone calls and everything, and then just kind of driving out and seeing people coming back. So I guess that's kind of it's okay.
Mm,
Um, there's quite a few things I also find harder. Having case support, for example, if you need to do a home visit with a second person, I'm finding those kind of things harder. Um,
yes.
and I'm also finding it harder just because everything is slowed down. If you want a prescription now, you have to send an email, or if you, for example, just want a chart updated, or all those typical minor nursing kind of things becomes harder and
Mm.
slow down. Kind of you have to.
Case
Um,
management side of things seems to have had for me personally, I've had the case management side of things, which is organizing prescriptions, organizing doctor's appointments, organizing visits, mental health fact reviews, liaisons with lawyers, liaisons with this, that, and the other. It seems to be a bigger delay because there seems to be one step in between us doing something before it can actually get done. An example of that is just, there are certain people that we need to see face to face. Zoom's just not going to cut it. Phone conferencing is just not going to cut it. So, in order for us to book a room, I have to go through not just admin, but a coordinator. And then that coordinator has to go through a different coordinator who's at that building that we are now using for face to face visits. And then we have to see whether that aligns with whoever else has booked in it. And then they'll get back to me. So, on what used to take us one step, which is go to reception or go to admin, ask to book a room, and book the doctor's appointment at the same time, and then it happens. Now we've got like all these extra steps that I need to come through, and not to mention, they talk about what's that game people used to play, Chinese whispers, where you say one thing to another person says nothing, and by the end of the entire, by the time the message has reached the end, it's totally convoluted and different from when it first started. It's
mm,
just an extra stressor, which I'm not really enjoying at the moment. You
mm,
know, I've like I'm talking about freedom here, doing whatever I want to do, but then we have had a significant impact in our work freedoms,
mm,
which I think I am not enjoying at the moment.
mm. And it's hard. Like, I've also got a bit of an example to add to that. Even small things like you want a medication chart updated. Usually I just go to a doctor's office, I put the chart on the desk and say, please update. But now I have to, for example, email the coordinator, can you please find a doctor who's willing to chart it? And so it is definitely a little bit more of liaison just to get small things done.
Mm.
Um,
It's just not the way that this job was designed to be done. Our bread and butter is face to face assessments, seeing people
mm,
in their homes, doing that
mm,
assessment or figuring out what's the best way forward, safety plan, mental state assessments, and go from there. You,
mm,
you can only do so much over the phone. And I feel like phone phone assessments are okay, but they're not ideal. you know.
Uh, yeah.
There's because you miss a lot of things. You miss the body language. You miss certain aspects of the environment. You miss other people that's in that environment and how they act. You know, all these things that you can't really tell over the phone. Um, it does impact the way that we work, and my concern will be like later down the line if this continues to persist and we continue to work from home probably till let's just throw a ball we'll ballpark it and just say we're going to be working from home in this kind of setting until January next year,
Mm,
just not that I have any inside scoop about how long we're going to be in lockdown, but I'm just throwing it out there. I think there's going to be significant ramifications to our clients who actually need that face-to-face support, and yet we're providing that face-to-face support but at a much more slower rate because of what I mentioned earlier, all the extra steps we now have to do in order to provide what we would classify as straightforward face-to-face work.
yeah.
You know?
And Giovanni, do you want? No, I guess it's you know it's hard because on the one end, management is saying to us, do home visits only if it's clinically indicated or when it's urgent, kind of in a way, and try to use other resources at your advantage. For example, phone calls, Zoom meetings, those kind of things. Um, but what I've noticed, firstly, it's as you say, it's not the same doing a conversation and an assessment on the phone versus you know a face to face, because you see a lot of different. It's different when you do a face to face because you do what I call a bit more of a holistic assessment. Like you can have a look at the environment and a little bit more of what that person is presenting rather than what that person is saying. Um, but it's true, like, so on the one hand, they say try to avoid it as much as possible and be creative, around how you provide that kind of follow-up. But on the other hand, I find that, you know, the people we serve or the people we work with, this is probably one of the most difficult times, kind of for
Mm.
them as well. And they actually need that support. And so I'm kind of thinking, am I allowed to do a home visit now? Am I going to get in trouble if I do a home visit? Or is it actually, the other way around? I should be doing home visits, and I'll get in trouble if I don't do home visits. So it's really kind of an unusual time, I guess.
That's a good question. I think at the end of the day, we have to do it. I mean, we have to still remember that we work in a very high risk with a lot of high risk clientels. We work with males, females, Maori Pacifica. We work with people who are immigrants. The whole shebang. We work with everyone, and within that subcategory of people, they also have a major mental health diagnosis. So their proclivity to commit suicide is actually quite high.
Mm.
Especially if they're feeling overly isolated and alone, which is what a lot of them are feeling at the moment. So I think we have to. I guess one of the things we need to be doing is and I guess I kind of wrote it in my little opinion piece is that we're not really given a lot of, I guess, clarification or clarity about what to expect in the near future. We're kind of given, these are the current stats, these are what's happening now, this, we're responding to that, we're responding to this. But, uh, I don't know if it's fair or not, but I kind of wish we had a kind of pathway which they can kind of show us, like, listen, if we get to let's for example, the New Zealand gets to 90% vaccination, you guys will be able to come back to the office and try to go back to business as usual because that's what's needed. We need to get back out there and providing the support and care that we've been sort of trained and hired to do.
Mm.
Or something as simple as, if we go down to level 2, we can do this, but we're not given any of that. We're kind of just left to kind of do what we're doing now, and then we'll get an update. Okay, this is what's happened. Like for example, when there's COVID cases on the shore, we kind of get an update on that. This is what they're doing to sort of respond to that. So we're very reactive. I
Mm.
think, and I think that's DHB's New Zealand wide, that we're all very reactive to what's being presented in front of us. But I don't see whether it's happening or not. I don't see a lot of forward thinking or forward planning, if you get what I mean, because if they are, I haven't heard any of it. or at least I haven't heard any news of it. And I don't know how long we can continue to effectively provide care from the position that we're at now.
Gio, because even now, a few moments ago on the news, it was kind of announced that Auckland will be for another 2 weeks in level 3 lockdown. You know, and that's kind of, so it's almost like working on a 2 week time frame. And it's, as you say, there's not really kind of a discussion or a plan on long-term strategy, I guess.
I guess it's different. It's different, right? I mean, like, yes, for the population that's different. I think their lockdown is always going to be different to the way that we experience lockdown as healthcare professionals, because we're seen as the forefront of sort of managing like, for example, we have major mental health issues. ED is going to be focusing on, serious medical issues. But at the same time, we all have to be aware that COVID is kind of mixed in with all of that. So it would be nice if we would have use the word that the buzzword that everyone's using now, which is like a roadmap of kind of like, where are we sort of going with all of this, and what can we expect? Because a little bit of direction would be nice. I don't, I actually, maybe I'm speaking out of turn because I didn't go to the last business meeting that was held last week, but I don't think anything significant come out of that business meeting, as far as I know. So it kind of sucks, I mean, we have a job to do. It's a hard job as it is already, but then now we're kind of having to maneuver our way through all these different regulations and restrictions, and expected to provide the same or even better care than we did when we had all the resources available to us in the first place. So it's tricky, but it's tricky, dude.
It's tricky. And I notice even with the NGOs, some of the private sector we work alongside, like Welsh Trust, for example, at the moment they're not doing face-to-face unless essential, for example, helping people to get their, vaccines and stuff. So I've got a few people on my caseload that would definitely benefit with a community support worker, to support them in their recovery and their goals and things. But that can't happen, and I can't actually. So I've been saying to the people, that referral has gone through, but I don't actually know when they're able to provide that face-to-face interaction. So everything is definitely slowed, and service delivery is definitely impacted. And
the longer we kind of do this, like, and that's kind of like the point I'm making, the longer we kind of do this, if there's no significant shift in terms of what we do, or a shift in the ability of what we can do, should I say, I think there'll be quite serious issues later down the line. I think we've had quite a few people relapse during this time who's unfortunately needed to be taken to hospital. I have a lot of clients who are experiencing early warning signs, who have been well for over a year, So I'm starting to notice that things are starting to unravel slightly, which is kind of what happened in 2020 when COVID first became a thing, because everything was fine the first 7, 8, 9 weeks of lockdown. And then things progressively got worse. It was almost like the calm before the storm. And I feel like we're now coming to the end of the storm, and, everything's the end of the calm. And then now the storm's going to start hitting us very shortly.
No, so I basically decided that I'm going to use my home as a base, as much as possible. And I'm actually going to go out and do face-to-face interactions, and still utilize, kind of Zoom and all those, phone calls and, other kind of option or kind of platforms as support. But I feel a lot better if I actually just at least make contact with the person, have a face-to-face meeting, and it makes me feel better than I'm a proper assessment has been done, a proper supports are being provided, and I actually do what I can to support that person at that time. And sometimes just that point of contact, it shows to people, hey, you're not alone. There is support, and
I mean, you can only do so much, though. I guess that's the point we're kind of making at the moment, isn't it? It's like you can only do so much with what's available to you. So I don't know. what things are going to look like. I hope at some point we get to go back to the office, some point soon. Even if we stay at level 3 for another 2 weeks, I do hope at some point we can get back to the office and then start getting, our work done. I mean, like, listen, it sounds like we're not doing any work from home. I mean, we are doing lots and lots of work, but I think we need to remove some of the barriers in place that prevent us from fully doing our work. I mean, I don't agree with the teams being split and then one team on, one team off. We are all going out into the community, so we're all at high risk of walking into someone who has COVID. Regardless of how you screen people can be asymptomatic and have COVID.
Yeah.
So you go into the building, it. I just think it just lessens the amount of resources or people that you can rely on to to effectively go out and sort of provide care. So I'm not sure how things are going to progress moving forward. I definitely hope we are back in the office before Christmas, before November even. It's October. Shit. Damn, it's October, dude.
I can't believe it. Just a few weeks
18th of October, too.
October, yeah. So Christmas is coming. It's on its way.
What the hell, man? How's that Christmas gonna look? I
I
can't even
know.
remember what last Christmas was. Did we even have? We weren't in lockdown last Christmas.
No.
We were okay by then.
Yeah.
But I mean, but it was different then. We didn't have Delta, and this looks like it's gonna stay. They're not pushing for elimination anymore, because that's obviously not working.
No, and the numbers are increasing, kind of in the community. So I've got a feeling it's just a matter of time and it's going to reach our office. I just hope it's not me.
Yeah, knowing you, you've had the worst luck, haven't you? You had the worst
with
luck.
my screening, man. I'm so over screening, you won't believe it.
Yeah, but that screening tool is only as good as the answers that you get back. I mean, you can ask the questions, but if they don't remember, they don't know. Oh,
yeah.
Fuck, dude. What the hell? I mean, we wear masks all the time. We go see people, but sometimes the screening tool is good as a baseline, but holy shit. It doesn't help when you get like a chest infection, and it's definitely not COVID, and you're going around coughing and you're trying to assure people, Liz, I don't actually got COVID, dude. Honestly, I don't.
Or a little bit of hay fever there, Gio.
Oh yes. Well, this was the same situation last year, wasn't it? You had hay fever and you kept coughing and sneezing in the office, and everyone was like, "What the? What? This guy needs to go home. You need to get out of here."
Sounds sicker than the people I'm screening, Gio.
Oh man, when you look around, because how long we've been locked down? 8 weeks now, going on 8 weeks or something like that.
I can't believe it.
Do you think the New Zealand population is settling down, or they're going to start amping up soon in terms of their frustration with lockdown and everything?
Gio, I think it's actually a good question, because it's a very fine line, I think, because on the one hand, the New Zealand approach is to get as many people vaccinated as possible. That's my take on things. And I'm hoping that once they reach a specific target, whatever that may be, hopefully the economy can actually open up again and we can carry on as usual. Probably wouldn't be the same, but the new norm. I think there's restrictions of the level 3 and level 2. It's more in place to reduce the spread of COVID as much as possible, with contact tracing and things coming in place, so that I guess ED departments and is able to cope with the influx, so that people, for example, don't run out of resources when they need that support. So I guess it's just a way of slowing it as much as possible, with the aim of getting people vaccinated. I guess the question is, the longer you keep people in lockdown, especially in level 4, I think is the main one. People get frustrated, people get stressed out, and that's where you get, for example, a bit of protests and things. And we've seen it, all over the world with riots and stuff, all the way from Australia to the Americas and the UK and everywhere. So it's a very hard question, because then you've got, I guess on the other hand, a lot of people who, for example, where's the conspiracy theories come in, they don't, for example, believe in COVID-19, and Um, yeah, so
Yeah.
that makes it harder, and it borders on that informed consent. Do you consent to a vaccine or not? So it's
Mm.
um,
Oh, here's a good question. Now that you
yeah.
kind of brought up the vaccines, um, do you think vaccines should be mandatory? There is talk about using a this is a worldwide discussion. This is not just localized to New Zealand, but they're
Yeah.
talking about using almost like a vaccine passport, which gets
Mm.
you access to this, then the other. I see certain shops in Australia even as well, where they're not allowing people to access their services unless you've been vaccinated, and you have to have proof that you've been vaccinated.
Mm.
Do you think that's the way forward in terms of like getting people vaccinated and actually stemming the tide of COVID?
Do you know my personal opinion? My personal opinion, I think having a vaccination should be that person's choice. It should be informed consent. Um, I personally think, a big drive should be in place, for example, educating people, what is the vaccine, why they should get the vaccine. But there should also be, for example, a lot of incentives in place, for example, to help people get vaccinated. It can be anything from advertisements on
Mm,
television, um, you know, health professionals advocating it, but it can even be something as small, for example, as getting free taxis or whatever that may be to get
mm,
access to clinics and things. Um, Incentives rather than being penalized or being alienated or being discriminated upon.
mm,
Because a lot of people will, for example, upset as saying, where's where's that line? For example, my informed consent versus me being discriminated against. If I don't have a
mm,
vaccine, I can't fly to a different country, or if I don't have a vaccine, I can't enter a specific shop.
mm.
Um, it's so personally, I don't think it should be mandatory. I think it
Mm.
should be personal choice.
Yeah, I mean,
But yeah, yeah.
in a nutshell, for me, should vaccines be mandatory? The answer is fuck no. No way. And listen, this is coming from a person that's gone
Uh,
both of his jabs. Okay, so I'm fully vaccinated, and I still hold this belief that if you don't want it, I think you are within your right to refuse it. But I think there's also other concerns where you start seeing places where they're saying if you're not vaccinated, you can't work here, so your employment is put into sort of in jeopardy. There's like I mentioned earlier, there's certain areas which you can't shop in because they only accepting people who are vaccinated. And what you're doing is you're creating like a segregation of different people and dividing the population. I think I'm a little bit sort of different to what you said. I do believe we should create not necessarily incentives, but we should demolish every barrier that is out there for people to get vaccines. And that's, like you said, free transport and taxi trips there and back. I think education is a very important part. We need to be sort of putting it out there and getting people to sort of understand the reason behind the vaccine, why we're pushing it, why we think it's going to be helpful. But also we need to be well aware that people don't need to get it. I mean, there's certain people that caught COVID already and recover from it, and they already have a natural immunity to it all, so they don't necessarily need the vaccine. So we have to be mindful that there's a group of the population that actually don't really need it at this point. But I think it's a tricky one because we work in healthcare, right? We know the effects certain diseases can have and the impact it can have on our health system. I mean, New Zealand's a small place. If majority of us started getting really sick and then ICU started to get full, we just don't have the capacity, right? We don't have the capacity at all to manage all of these sick people. So it's finding that balance of being able to, on one hand, listen, the vaccine's here, this is why we think it's good for you, and on the other hand, if you don't want it, that's still your choice, and we're not going to sort of penalize you for it. I think our number one thing we should be fighting for is our freedoms, and maintaining that. And I'm starting to sound like a conspiracy theorist. I'm really not, but I do think, and it's been shown over and over and over again, that when certain governmental institutions get certain powers, they refuse to relinquish it. You look at all over the world, this has been the case. Fight me if you think I'm wrong.
Mm.
But I think we need to be as vigilant as possible to make sure that, and this is the hard part, because to me there's no, I can see both points, so there's not really a straightforward answer to this. I think I think you should take the vaccine personally. I think if you're a high risk person and you work in high risk environments, I think you should take it. You know, people like us who are in the healthcare system, who are frontline seeing people on a day-to-day basis, while COVID is still a major thing out in the community, I think we should be taking it because we've got children. We need to make sure that, we're protected against it. Although it's 88% effective, you still have to weigh that up. But I think at the same time, you shouldn't be penalized for not wanting it, because that's your own personal choice.
And I guess, something to add to that, for example, me is, I've got some family members who's quite, uh, vulnerable to, when they, because of emphysema or whatever that may be. So I decided, if I, for example, get the vaccines and have that element of protection, hopefully, so it's, especially when you work in with a lot of people and stuff, I don't want to, for example, spread something that I could, for example, contain a bit or lessen the spread. There's all these different factors, I guess, to consider.
There's so many. I mean, and that's just one aspect of it all. I mean, shit. I mean, we have to realize that COVID is not really going anywhere. I don't think we're ever going to. I mean, it maybe. I mean, they talked about this last year as well when COVID became a thing, that we may be going to have to expect this like a seasonal thing that'll come and go like the flu, So who knows, man? Fuck.
Yeah.
I wouldn't be surprised if, say, a year from now, we're sitting down and then we're both like, man, I just got over a really bad case of COVID, dude. But, I'm feeling good. We're going to be talking about it like the flu. I'm not comparing it to the flu because that's not the same. I think there's been way more quicker. There's been a higher rate of deaths due to COVID than the flu. But I think it's going to become a normalized thing in our community where COVID will just be like another thing that we just may catch every year, like the flu. And I tell you what, whenever I get the flu, I get fucked over like majorly. I get chest infection. So fuck, if I catch COVID.
And something I was wondering is, and this is what I'm hoping for, Giovanni, I hope that a lot of these things, like the lockdowns and the immunizations even, for example, even dare I say COVID passport, all those things, I hope it's temporarily, not permanent, So if they, for example, use it for a short period of time, for a specific objective, for example, let's say get a specific population vaccinated or whatever that may be, I'm hoping it's short-term intervention. I really hope it's not long-term or, because I think most people can cope reasonably with, for example, a short-term lockdown or, for example, a one or two vaccines, or for example, wearing even a face mask short term, maybe 6 months to a year, just rough estimates. But if you have to ask me if I want to wear a face mask for the rest of my life when I go into countdown or pack and save, I probably would not. I would say no, I wouldn't like that, or if I have a passport every time I travel or every time I, like a COVID transport, I wouldn't like those interventions. That's why I'm hoping it's more short term.
Certain people might call you selfish for wanting to not wear a face mask, which is ridiculous in itself because it's fucking uncomfortable wearing a mask. Why wouldn't anyone in their right mind think or feel like they don't want to wear this anymore? It's a terrible situation. The entire fucking world is under attack by a single thing, and we still can't unite on it. It's ridiculous. It's ridiculous. But no, I am completely fucking over it, over the COVID and over lockdown. I want to go back to Tonga, bro. I want to go back to Tonga for a year.
On holiday.
and I can't do that because COVID, and Tonga is one of the few places in the world that doesn't have any active cases and has never had any active cases of COVID at the moment. So it's probably one of the safest places to be right now, but we can't do that. I hope we never get to the stage where we have to use a COVID passport. I really hope we never get to that stage, because I hear what you're saying, using it temporarily as a way to sort of stem things or to slow stuff down or to regulate this and that. But you know me, I'm against regulations, like you continue to regulate, why stop, and this is the point I'm making. Like, you do the COVID vaccine stuff, you do the COVID passport, and on paper it may sound like a good idea, and then it gets to a stage where the government figures out, and oh man, I'm starting to sound like the biggest conspiracy theorist ever. But the government will start thinking like, why do we need to stop now? We can regulate people, we can get people to do this, and then it eventually may evolve into something more than we bargained for.
Giovanni, and I guess the good thing about doing this podcast, it's actually a good platform just to actually have a vent from time to time, or just to say your own take on things. And I'll actually add to that, like me, for example, I'm, as many of the people listening and viewing our podcast, I'm also kind of so over it. I'll kind of share a little bit. So at work, for example, every time I go to the office, I have to wear an N95 mask, and I'm very sure the thing is giving me a rash, on my face. The second thing is, every time I see a colleague, or when I'm in a close vicinity with a colleague or with a client, I have to wear a mask. Then I have to, for example, do COVID-19 screens until it comes out of my ears, and it's quite a lengthy screen, and then at the end of the week or in the end of the day, I have to fill in a big form to say my contact tracing, kind of who I've screened, when did I do, and I have to send that away to the team leaders.
Oh shit.
So that's only a way on a professional kind of thing. That's not even included. Then if I go out, like many of us, if you go out, you have to put on a face mask when you go into a shop. You have to use your app and scan in, when you go into an app. So there's all these things constantly bombarding you day by day. And then you've got all the differences in family. Some families say, it's a conspiracy, it's a one world order, it's a mark of the beast, all those kind of things. Other people say, no, it's all to do with pharma, wanting more money, kind of. And this is all an unnecessary hype, of a variation of the flu. And then you have it on television, like, for example, what's the next levels, and how long you're going to be in lockdown for, and encouraging you to get your vaccines. And so it's a topic in hot discussion at home, and it's been at the topic for months now. And then you have
over a year 2020, man.
And then you have it, for example, in your family circles, in your friendship circles. So I've kind of taken the approach, I go with the flow, some people might call me a bit naive. I'm going with the flow, and then I focus a lot more on the things I can, like I do a lot of gardening and all those kind of things. But even a lot of my family members are sending me links and messages around COVID, and it's exhausting, and sometimes it kind of puts on that pressure. So I know what you mean, Gio. So I'm really keen to, so I'm hoping all this is temporarily.
Oh God. Yeah, I mean, yeah.
And I'm sure you can add a lot of stuff to that as well, but it's quite intense.
I mean, I'm lucky enough I don't have a lot of people, if any people in my family that's overtly sitting on the paranoid side of the scale. There's not a lot of them that are. I mean, they're very much agreeable that COVID isn't a real thing, and but I guess I'm sitting at a spot where I agree COVID's a real thing. I just think certain people are benefiting from it, like how certain people benefit from wars, famine, all these things, all the great atrocities that's ever happened in the world. Someone benefits from it, and I think those people are the ones that are kind of making things, a little bit more difficult than it needs to be. Now, I don't know if it's the demon worshippers or satanic ritual stuff that's happening. I don't think that's the case, but I do think there are actual real bad people out there that will look at this as an opportunity to make money, gain more power, gain more control, whatever you. I think that's just human nature. People are going to see an opportunity, they're going to seize it, whether it's right or wrong, all for the sake of power, money, whatever those people might actually look as that's valuable, you know. Who they are? Fuck, should I know? I don't know. I have no idea. I have no idea. But if I was in that position, I'd probably do the same thing too.
Yeah, no, I agree, Giovanni. Even just the mask sales probably has gone up, in the world.
Bro.
So just something as simple as masks and gloves,
I mean, they've implemented so much into society now that places like Culture Kings are selling like masks, like as a fashion statement. Like there's this fashionable mask. That's how much it's been sort of embedded now into society and how normalized masks are. Let's rewind back to 2019. If you saw someone wearing a mask, you'd think like, why? Why are you wearing a mask? It's like, why? And now you wouldn't even think twice at looking at someone wearing a mask. You wouldn't even do a double take.
I still remember the first time, when this happened in 2020. Was a different manager at the time, but I had to go down and see a person in the office, kind of a person presented with concerns, and I had to go down, and suddenly I have to wear PPE, and what do? I was kind of like all frantic. So I put on my mask just before I go down to see the person, and the manager just walked past and like, LJ, put it on when you're downstairs. You don't want to scare the person. And then moments later, I heard, no, you have to put it on before you go, and it's all these kind of,
You have no idea. There's so much different information. You can't even. It'll make your head spin. The amount of different. Yeah. No, I mean the funny. I was about to talk to you about, because you were talking about N95 masks just before, and so for us, for people who don't know, N95 masks are the new recommended masks to wear when you're interacting with people. As a precaution, that's kind of like the surgical mask, or sort of like your basic go-to mask. That's what everyone wears. The N95 is like surgical mask on steroids. So like it's really good. You even have to go through a test for it, where they
a small training session.
Yeah, a small training session on how to actually put it on. There's nothing special about it. It's not metal. It's just got rubber things, and it's like a really thick mask. I'm sure the people actually designed it. They're like, what the fuck? It's more than just a thick mask. I get it. Yes, I get it. There's a new filtration system. Blah 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 blah. Yes, no. I'm just making a point about just masks. So they called me up. It was my turn. I was one of the first to go get tested for it. So because I have to test the fitting, so I go in straight away. The woman sees my beard, and she goes, "Are you going to shave your beard for this testing? Because if you have a beard, you can't do the test." And I said, "Do I have to shave my beard?" She goes, "No." So I said, "Oh, then no, I'm not going to shave my beard." So she failed me on the spot. So at this point in time, I cannot wear an N95 mask because it's going to be worthless. It's going to be useless. So that's kind of, and I don't know what ramifications that's going to have for me. Does it go back into the building? Does that mean I can't come back to work?
Does it mean they'll force you to shave the beard, if I dare say that?
We'll see. That's the thing. I'm not sure if this is the hill I want to die on. Like, I want to see how far I can take it. Not because I want to take the piss out of things, but, I feel like, this beard is kind of, as weird as some people may think, I've this part of my identity. If I showed up to work one day without a beard, everyone would be concerned for my own mental health. I think that's seriously what everyone's going to be thinking. Like, Gio's, he's lost the plot. He's finally taken the last straw. He's fucking lost his mind. He's just shown up to work with no beard. So I do. So I don't know if I'm willing to shave it. But at this point in time, the DHB, as far as I know, cannot force you to do it, and you don't have to have a religious reason behind it. It's just personal choice, So I don't know.
Gio, it's interesting because it's true, because it's your choice. It's informed consent. You decide you don't want to shave off your beard. That's your human right. And
Is it a human right though? This is the question. This is the question I keep asking myself. Is keeping your beard a human right? I mean, I think it's my personal right to want to keep my beard,
Well, I would say it, like, Gio, because the only person that, well, my take on it, that can shave your beard is you yourself. No one else in this world is allowed to shave your beard. Not really.
Well, they can hold me down and shave it, I guess, But well, I don't think they'll do that. But I mean, if they wanted to, they probably could.
Yeah.
But I don't know. It comes down to choice. I mean, are they going to respect my choice not to do it, or are they going to make it mandatory that
They'll probably use their health and safety.
I'll just tell them I'll work from home.
Yeah.
But this is the thing, and is that a good enough reason for me not to come to work? Not being able to do my work? I don't know. Some people may argue yes, some people may argue no, but I mean, are you willing to drastically change or not change, but are you willing, and this is the question I guess I'm kind of putting out there, is are you willing to drastically change something about yourself that you really like in order to, I guess, get into line with everyone else? Maybe I'm overstating things there, but that's kind of the way that I'm looking at it. Like, are you willing to change something about yourself in order to fall in line with everyone else? My answer at this point is no. But like I said, this is not, I don't know if this is the hill I'm going to die on. I don't know if this is going to be like the thing that I'm going to take to the next level where I go out and start protesting, save the beard. I don't know, but at this, I don't want to shave my beard,
But do you know something I've noticed is that, as far as I know, is you've not really been given any strong directive from the DHB to shave your beard or to do that training or to have the N95 masks fitting. Not as far as I know.
No, they haven't. I mean, it is a requirement that we have the N95 mask when working from our offices, but we're not working from our offices at the moment because we're working from home. So I think in that respect, they haven't needed to, but I'm waiting to see what happens when we go back to the building. When the UCC finally gets moved away of the urgent care center that's at our office, when that finally gets moved away to a separate area, will I still be required to wear the N95 mask?
Yeah, and the big thing is we also use the N95 mask when we do full PPE. It's part of the full PPE assessment when you have that, I guess, different screening, like blue screen and yellow screen. Personally, I wouldn't want to go back to the office if I have to wear the N95 mask. I'll look like an alien in the end with my skin rash. So
it would just be a rash right around your nose, all the way under your chin. Just a line. Well, see, that's the thing. Will they penalize you because you're getting a reaction to the mask? I mean, what do they do? Are they going to just tell you to harden the fuck up and just wear it anyway? Or will that give you an exemption not to wear the mask? Putting you at risk and others at risk of COVID. There is no black and white answer to that. I don't think any intervention they put in place is necessarily going to cover every single person. You know what I mean? Fuck it. We'll have to see how we're gonna have to see how it goes. I think we have a long way to go still, and shit's just gonna get harder. I think that's what I think.
That's what I am doing, Giovanni. Is at the moment I'm just going with the flow and kind of seeing what's the next steps and what's the expectations. For me, like, I actually did shave my beard twice.
I know, and I called you out for that shit.
Yes, went for that fitting twice. The irony is, I was
you went twice. Why'd you go twice?
Because they rescheduled it, but then I was still sick at the second time.
That's right.
Then I couldn't do the fitting. And this week they actually said there's a third mask fitting. I can go, but I decided not to respond to the emails. So,
fuck it. You guys can come to my house and do the fitting. I'm like,
shave my beard for me. And then No, so I'm
They
also
may
going with
do
the
it.
flow
They
and
may
see what
do it. I
what
wouldn't put it
happens.
past it. You know what I also think? Like, I wonder how much of an impact this is going to have on the switch over of the DHBs to our one healthcare system, our universal healthcare system. Uh, I wonder if this is going to make a delay at all. Because technically, by next year, July, we should be completely converted over. No more Waitemata, no more Auckland DHB, you know, no counties, no nothing.
So it
So
would be interesting to see if our names stay the same or whether it's a new name and what that would be. Yeah.
yeah, yeah. I mean, that deserves the whole conversation in itself, but I don't think a lot is going to change. I think the biggest changes we'll probably see is managerial changes. Some policies, I believe, are going to change. Things like transfer of cares and things to other areas, I think, are going to be a little bit more easier, being under one DHB. I'm wondering if our system will change. That's what I'm most curious about. Will our system that we use to document and do referrals and things like that, does that all change? Because not every DHB in New Zealand uses the same record keeping system.
Yeah, and the same platform. Like for me, I think that our system is quite dated. Like it's not very user friendly, and it's I would call it a very boring program.
What?
So it would be nice for it to be a bit more modern and user friendly. Make it exciting to do some work.
What do you think it's needed? So you may.
I wouldn't mind different colors with some chorus there in the background.
Some awesome background pictures. I don't think it'll be interesting, but I think that's a conversation for another day. I think the switch of the DHBs is going to be a big topic at some point for anyone working in healthcare. But actually for everyone in New Zealand, because this impacts everyone, right? The whole changeover of the DHBs technically was brought forward because, well, from my understanding, is because there was a lot of disparities between DHBs and what certain people can get, which is odd because you're not necessarily, yes, you're kind of restricted to where you live, but there's nothing stopping you driving all the way to from Bay of Plenty to Auckland to go see a doctor there. So I don't understand what they mean. Who knows? Just in a nutshell, do you think the changeover will be good or bad?
Yeah, I hope for the better. I'm an optimist, so I hope it's better.
Yes, you're a sickeningly an optimistic person. Sickeningly, which is actually a good balance for me, who's very pessimistic about every fucking thing that happens in the world. So me and you make a good team on that space.
But like even with, as you say, there was one point where I said to myself, I will never do an injection without a medication chart again because I had an incident.
I remember that day too.
Yeah,
you got told
I relied on technology for an answer, and it failed me. It showed me a different dose and stuff. And now lockdown came, and getting a chart, getting it signed by a doctor, it's not that easy. So here I am doing injections again without med charts, relying on technology. So I'm really hoping, and it's because I have to adapt to the situation at hand.
Sure.
But I'm hoping that the technology would, for example, replace things like med charts so that I can, for example, sign off the injections on the program, or online, rather than worrying about stickers and doctor signatures and stuff. So
no, definitely.
Yeah.
Oh man, dude, it has been so good talking to you for this long. Especially, I mean, yes, it's still work related stuff, but it's good to get back onto the having these conversations that we used to have in the car quite often. So it's good to be back on the mic, back talking. So let's keep it going. We'll continue to bring up topics and continue dropping more episodes, because I think there's still a lot more we have to talk about. Still a lot more left.
That sounds good.
Cool.